Hey everyone, how we doing? So I want to make a video on some general pathways for the just for blood volume, cardiac output, how they're all interconnected, how increasing cardiac output is going to be affecting blood pressure, etc., etc. So as we learned in the heart or the cardiovascular portion of the physio, was that cardiac output is equal to stroke volume times heart rate. So if we're to increase stroke volume, we're going to increase our heart rate. We're going to increase our cardiac output. And if we increase our heart rate, we can also increase cardiac output. And increasing both of them is even better. Then we saw that, blood pressure can be increased by our increasing our cardiac output and our total peripheral resistance. And cardiac output is equal to stroke volume times heart rate. Total peripheral resistance is the level of vasoconstriction within our blood vessels, or the vascularity. But the big thing that the kidneys do is they work on increasing our heart rate by increasing our cardiac output, by increasing the blood volume, and then also some of those hormones cause some vasoconstriction. And I'm going to show you how that happens right now. So I'm going to minimize this for a second. So when we look at our blood vessels, we have blood in the kidneys, peritubular capillaries, and then we have fluid and water going back and forth between the nephron and the peritubular capillaries. So we can have a couple different situations. These two situations I just have if our blood osmolarity is high versus if our blood osmolarity is low, and what happens when you make that happen. So the first one, this is an example of ADH, and these are just general pathways. So in general, if we increase our blood osmolarity, or the sodium in the blood, that's going to cause an increase in water retention going back into the blood via osmosis. When you increase the water volume in the blood, that's going to increase the blood volume, the total blood volume. Because there's more water in the blood, that's going to then increase the amount of fluid which becomes our blood. Now it's going to also, when you increase the water in the blood, that's going to end up diluting the sodium once the water diffuses in. So it's going to dilute or make the osmolarity go down. But when you increase the water in the blood, that's going to increase the venous return, which is just the amount of blood in our veins returning to our heart through the inferior and superior vena cava. So then that goes to our atrium, and then our atria dump that increased venous return into our end diastolic volume, EDV. When you increase the end diastolic volume, that means that there's going to be more blood in the ventricles during our ventricular contraction, right? Or ventricular systole. All right, so when you do that, that's going to increase the stroke volume. All right, you see where we're going now? When we increase our stroke volume, And even if we don't increase our heart rate, that's going to have an effect on our cardiac output. All right? So when you increase the cardiac output, and if you want, you can increase the total peripheral resistance, because usually these hormones like ADH or aldosterone or even angiotensin II are going to cause a vasoconstriction at the same time. And when I say vasoconstriction, that's going to cause the increase in total peripheral resistance, but this is more about the blood volumes. So when you increase all of these, if we look back at that first formula here, it's going to increase our blood pressure. All right, when we increase, that's going to have an increase in blood pressure right here. So now the next part that I want to go over is when we do all of this, that's going to cause our urine to go down. There's going to be less pee. And in general, when there's less pee, you're going to usually end up having a higher blood pressure because you're trying to compensate for the lack of blood volume. All right, so now we're just going to do the reverse to see what happens when our blood volume goes low. All right, so don't trip out. I just want us to have a good idea of this general pathway. So if you look at it, you're like, oh, okay, this does that, so that's going to happen. That's what he gets to the end, these type of conclusions so quickly. Because if one happens, the next is going to happen. It's a cascade. So this next one is going to be an example of a hormone called ANF. ANF is called atrial natriuretic factor. It basically does the opposite of what ADH does. So it's basically the opposite of ADH. So what it does is it's going to decrease our blood osmolarity, and it's going to decrease our blood, the water in the blood. All right, so when we decrease our blood osmolarity, there's going to be water being secreted into the nephrons. All right, so decrease blood osmolarity, decrease the water, because osmosis. Just make it simple, because of osmosis. So then the next thing that happens is when you decrease water, you decrease blood volume. All right. When you decrease the blood volume, guess what you're going to have less of? You're going to have less venous return. Less blood returning to the heart from the veins. And when you have less blood returning to the heart from the veins, you're going to have less blood in the ventricles at the end of diastole. So a lower end diastolic volume. If we decrease end diastolic volume, say it with me, we decrease stroke volume. All right? When you decrease stroke volume, you decrease cardiac output. When you decrease cardiac output, what do we get here? Well, we're going to get the opposite of this one. We're going to get a decreased blood pressure. But the overall effect is going to be this increase in urine output, which is going to be a decreased blood pressure. Now, if you're thinking, well, does aldosterone also decrease our blood osmolarity? And yes, but it does it it does it by increasing the water in the blood vessels, where atrial natriuretic factor does it by decreasing the water in the blood vessels by secreting sodium back into the nephron. All right. I'm not sure if he's going to ask us this one, but this is the way that blood goes in and out. So when our blood pressure goes up, there has to be something that's going to do the opposite, and that's what ANF does. So whenever we're talking about blood pressure, blood volume, or blood osmolarity, meaning the solutes in the blood, know that this is going to the kidneys are going to play a really big role in it because of just the simple relationships between all of these factors. All right, yeah, we can cause vasoconstriction, and that's what those secondary blood vessels do to kind of work on shunting blood off to certain regions and sending more blood to other areas. but this is kind of the bulk of the cardiovascular urinary system. All for now, I'll be putting up a video sometime later on the rest of the kidney stuff, and then I'm going to try and simplify some of the pulmonary stuff so we kind of have an idea of how he's going to ask the questions. All right, guys. Until next time.